Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Every day we improve studying together. Today is I think 17th NEETPG mock test in the series of 70 NEETPG mock tests before March 5th. Even on March 4th, we will have a NEETPG grand test and a discussion. And this 70 full-scale grand test, 100% strike rate is there in the tomorrow's actual NEETPG exam. So whatever be your legacy, whatever you did previously doesn't matter. At least from now, if you become sincere enough for the next 50 days, the chance of becoming a NEET-PG topper is very, very high just by attending these mock tests and discussion every day with Dr. Murli Bharadwaj. Download the Score app, sincerely sit for 3 hours. Every day morning, 10 a.m., the mock test begins and solve the paper. You will get a predictive rank and scoring. And in the afternoon or evening, I come and discuss all the 200 questions. And you try to contemplate what topics you need to improve. So that is how we will make a small step every day ahead. So thank you to Kaushik and Dr. Deeksha and Bharat for joining the session. So I am a bit late. Let's start the game. The mid-cut loop rotates. Suresh, did you put in all the groups? A total of how many degrees? 270-degree counterclockwise rotation is very important. So all the wall willers and mid-cut non-rotation issues, everything you should be sure. Collateral circulation to bypass the constriction and become dilated postductal coarctation of aorta. What vessels are involved? Internal thoracic, superior epigastric, inferior epigastric, but not internal iliac. So you should know very well what are the branches of the aorta is one of the favorite questions of the exam. Huh? This was a question paper we conducted in Usmania Medical College about 12 years ago. 12 years, except SPM questions, which are new. And few subjects. Otherwise, medicine, surgery, gynops, orthopedics, they're all very standard. That's the reason, except false are more. But that is a way, examiner has a way of asking, like ABC is right or AB right, like that, right? So, but these are very fundamental questions. With regard to the trachea begins at the level of C6, not the C3. What is a traction epiphysis? So it is the lesser tubercle of the humerus. So you should know very well all the different types of epiphysis, types of joints, favorite question of the examiner. At shoulder joint, pectoralis major has typically adduction, flexion, and medial rotation, except lateral rotation. So, simple and facilitated diffusion. So basically, they all occur down the electrochemical gradient. So whenever it becomes carrier mediated, then it becomes saturable. When it is carrier mediated, then it requires metabolic energy of ATP. And any competitive inhibitor can be able to inhibit only if it is carrier mediated, because it will go and sit in carrier and will not let this sit on the carrier. Increase in heart rate is due to adrenergic beta-1 receptors. Ventricles are completely depolarized during ST segment. So QRS complex and T wave is repolarization. QRS is depolarization. ST isoelectric segment is the, what is that segment? What is the wave in ECG? Whenever it include one uh, wave with the isoelectric line, then it become interval. Only if it is isoelectric line, that becomes segment. So whenever you say PR interval, what is the meaning of it? P wave beginning say QRS beginning tak, you call it as PR interval. So that's the story. When a person is standing, blood flow in the lungs is highest at the base, because this is where the difference between arterial and venous pressure is greatest, is what you need to remember. So once more, V by Q in the lung, where is ventilation highest? Bottom or apex? Diaphragm ekkudundappa? Lung kindundiga. So that because diaphragm is below the base, base has high ventilation. Because of the gravitational pull, circulation is highest to base. So there is an increased V, there is an increased Q, both when you travel from apex to base. But the increase in the Q is more than the increase in, if this is only one arrow up, this is 3 arrows up. So that is the reason V by Q ratio is highest in the apex. Ikkademo 1 by 2 అనుకోండి. Agree? 1 became 2 here. But 2 became 6 here. So is 1 by 2 big or 2 by 6 is big? Both increased. 1 increased, 2 increased. 1 became 2, 2 became 6. 2 by 6 is hardly 30%. But this is 50%. So that is the reason ventilation is high, circulation is high by the time you reach base. But V by Q ratio is highest in apex. That is the reason Mycobacterium love to live in apex, because it want a east-facing apartment with a good cross ventilation, with a view of the whole world. So apex में बैठता है Mycobacterium. So you go to Kompally? Not it. So wood substance must be further digested before it can be absorbed by specific carriers, doctor. Sucrose. Only monosaccharides can be absorbed. Sucrose is a disaccharide. It must be digested to monosaccharide before it gets absorbed. But in case of the sucrose, first it will be broken down and then only it will be absorbed. We don't have a sucrose carrier in our... but amino acid also, we need to break the peptide. Amino acid is not, is it carbohydrate? We are talking about what? If you look at alanine, it's a single amino acid. Fructose is single glucose, carbohydrate, monosaccharide. Dipeptides are also absorbed, but sucrose is a disaccharide. That need to be broken down. Clear? Clear? A major driving force for protein folding is the hydrophobic effect. So, what is the hydrophobic effect will do? So, hydrophobic amino acid side chains tend to cluster together so that they will increase the entropy of the water. Enthalpy is heat, entropy is randomness. T of 3A is necessary for transcription of tRNA. Once I told you tRNA, all this story you need to thoroughly read in biochemistry, DNA polymerase, etc., etc., etc. Okay. So, Seventy, 50%. Okay. He did 100, he got 40. 40. आपको around 35-40%. Simple. From 40%, how you will go to 80? 40 to 80. That is the journey. 50 days time is given by you by the God. So I'm telling you now, comfortably हम पहुंच जाएंगे. It's like you are traveling to the airport, crossing the traffic jam. Only until outer ring road Gachibowli. After that, zoom, you'll be in airport. अभी जरा ट्रैफिक जैम चल रहा है, क्लियर करके आगे बढ़ेंगे. तो cyclosporin A protects against the organ rejection. How? It blocks the dephosphorylation of specific transcription factors. So cyclosporin A binds to the protein called cyclophilin, and this protein complex leads to inactivation of calcineurin. Calcineurin in response increase the cytoplasmic calcium that will activate its phosphatase activity and dephosphorylate the cytoplasmic nuclear factor. In the story. Could you get me? Cyclosporin jaake bind with protein cyclophilin that lead to inactivation of calcineurin. Calcineurin in response to increases in cytoplasmic calcium will activate its phosphatase activity and dephosphorylate the NFAT. NFAT is a transcription factor. So once more, please make a note. Immunosuppressants. How does mycophenolate mofetil work? Sirolimus work? Cyclosporin work? All this we discussed in pharmacology. The 1200 pages notes I gave you is all the gold standard, doctor. Kindly do the revision of it. दिल में लगा के कल के फ्यूचर आइंदा जब हम एक इम्यूनो सप्रेसेंट के बारे में क्वेश्चन आ गया तो आप रॉन्ग नहीं करना. In a muscle under anaerobic conditions, how much ATP is produced from a molecule of glucose? 3 moles of ATP. So when glycogen produces glucose via glycogen phosphorylase, glucose 1-phosphate is formed. Glucose 1-phosphate is formed. And this is converted into 2 molecules of pyruvate and 4 moles of ATP are generated, and 1 is utilized at the PFK1 step. So totally the net yield is 3. But kindly go back and look at glycogenolysis. Okay? Glycogenolysis. So the synthesis of 1 mole of glucose from 2 moles of lactate requires 6 moles of ATP. So which is the step that requires ATP during gluconeogenesis, doctor? So some steps produce NADH, some produce FADH2, some will consume ATP, some will consume ATP into AMP, requiring 2 phosphates, some will produce GTP. So which step, which is happening in this totally is what, doctor? Not more than 10 to 12 pathways. Gluconeogenesis, glycolysis, citric acid cycle, electron transport chain, beta oxidation of fatty acid synthesis, glycogenolysis and glycogen synthesis, fructose metabolism, urea cycle, purine metabolism, pyrimidine metabolism, and the pentose phosphate pathway. खत्म हो गया. మొత్తం ఈ 10 to 12 pathways. I gave you 32 pages notes in biochemistry. Totally 300 paragraphs are there in the Score app. And please subscribe today only. And then there are about 20 hours of discussion. It is all organized paragraph wise. Most of the times, if you can understand paragraph by yourself, you don't need the video. And also, I provided the PowerPoint with all the colorful images support along with the video library. Just you need to do revision because basic sciences may very easy to conquer basic sciences, and basic sciences are the bloodshed zone for many aspirants. Why? Because they study it about 6 years ago. No, something which is 6 years ago to dig it is very difficult. If you dig it, you are digging gold. Ecovirus are cytopathogenic because they mainly affect intestinal tract. Group B streptococci in the neonate, typically in the absence of specific opsonizing antibody, phagocyte recognition and killing do not proceed normally. So group B. So group B streptococcal diseases commonly are part of the maternal vaginal flora and they lead to development of the neonatal meningitis is what you need to basically remember. Very good to see 14 online classmates. हम बहुत खुश हैं. Now, which is the best isolate for chlamydia pneumonia? Culture of respiratory secretions in HeLa cells. So reversion of Neisseria gonorrhea from fimbriated to non-fimbriated form will cause inability of the gonorrhea to colonize. After all, colonization is the courtesy of presence of fimbriae. Streptococcus pneumoniae are characterized by repeating polysaccharide capsule of glucose and glucuronic acid. So sialic acid polymers are found in Neisseria meningitidis is what you need to remember. Then what is the most dangerous subtype of the pneumococcus? Type 3 is most dangerous type. Mycobacterial cell wall में क्या होता है? Glycolipids. Waxes will be there. Alcohol withdrawal में you use delirium tremens में lorazepam. Potent analgesic but a weak anesthetic is. That's the reason you can't give nitrous oxide alone to cause anesthesia. You need to add it with some other anesthetic is what you need to remember. A 58-year-old woman, which antiarrhythmic is likely to cause the symptoms of heart rate of 10 beats per minute lower than her previous rate? Amiodarone. So anything about amiodarone, you need to be very sure because it led to, what are the two side effects of amiodarone? It can lead to hypothyroidism, even hyperthyroidism also. It lead to pigmentation of skin, pulmonary fibrosis and amiodarone. In the eye, what is it called? Verticillate keratopathy. Verticillate keratopathy. मैंने बोला ना, amiodarone, lithium, 4 things you need to remember. Tricyclic antidepressants, digoxin, इनका पूरा रेडी होके जाना. वन ऑफ दिस 4 नहीं है तो मेरा नाम मुरली भारद्वाज नहीं के पेपर so drugs that atropine is anticholinergic. Especially when the bladder is acetylcholine comes, bladder contracts. Anticholinergics all will relax the detrusor, which is required whenever there is urgent continence. मतलब ఒక్కసారి బ్లాడర్ మందులు ఉన్నాయి కదా, బ్లాడర్ డ్రగ్స్ एग्जामिनर छोड़ेगा नहीं, जरूर पूछेगा. What describes about buspirone? Buspirone never causes drowsiness, which is the advantage of buspirone. Lack of sedation very little or no potentiation of other CNS depressants, including alcohol. It will not cause any abuse potential, or there is no tolerance, no major withdrawal syndrome. That all make buspirone beautiful, right? But one major problem is slow onset of symptom relief. That is a main problem. So everything about buspirone, clozapine, and typical antipsychotics like haloperidol, blah blah blah, आज ही घर जाके खत्म करो. Similarly, SNRIs, SSRIs, right? And all these things, doctor, anxiolytics, antipsychotics, sedatives, and hypnotics. Oh, this is one area all medical students clean bold. Only the top 1,000 club will master them, or Murli Bharadwaj students will master them, right? So because we will pump a lot of sedatives to them, right? So we have a patient who is taking tricyclic antidepressant, which block the neuronal catecholamine reuptake. Now, if we continue the tricyclic, which drug most likely to have its antihypertensive effect affected? Guanadrel. So how does guanethidine, guanadrel is used? Mechanism. Hypertension management. It must be taken up by adrenergic nerve endings in order for it to show the effect. So that require intraneuronal transport through the norepinephrine receptor. So if you happen to block the uptake phenomena by using tricyclic antidepressants or cocaine, then the guanethidine doesn't work. So though we don't use guanethidine that often to treat hypertension, this is for basically to show you mechanism of action of how the ganglion blockers like guanethidine, guanadrel, they all act, and how the tricyclic antidepressants and cocaine, how do they act? So cocaine, tricyclics, they will cause a decreased neuronal reuptake of adrenaline. And the same uptake of the adrenaline is the mechanism for the guanethidine to act. So that is the reason there is a drug interaction. Once more, doctor, what we do know, in the notes we give how the guanethidine, everything act, and along with pictures and all that, while discussing the antihypertensive classification. So please take opportunity to do the revision, doctor. Now, can online students can punch? Is the voice loud and clear, doctor? Can you please punch? Is the voice loud and clear? I love to see a hi from all of you. So very happy to see 15 online classmates. Worst case, minimum 100 questions हम discuss करके जाएंगे. 200 तो करेंगे, कोई बात नहीं, right? So some days when energy levels are low for the teacher, at least 100 तो करके जाएंगे, right? So from tomorrow, Mithuna, Vinisha, everyone will be coming regularly, Girija and all. So very nice to see MedMix and many more. Good. So, doctor, 18-year-old, third episode of kidney stones in the past year. So basically, one of the functions of vitamin A क्या होता है? Vitamin A maintains the epithelial maturation. If the vitamin A deficiency is there, then there is a squamous metaplasia that happens, not dysplasia, metaplasia in the urinary tract, that act like a nidus for the recurrent urinary calculi to form. So that is the relation between vitamin A deficiency and kidney stones. So with regard to the tumor suppressor gene, CDKN2A codes for a protein called P16, which acts on G1 to S checkpoint of the सेल साइकिल. Once more, doctor, मैंने कल भी बोला आपको, सेल साइकिल, रेगुलेटर्स, CDKs, right? And all anti-neoplastic drugs, doctor. Classification, mechanism, and toxicity. Make it a point to do the revision in the notes. Hardly it won't take more than 2 to 3 pages. Vinca alkaloids, how do they work? Cyclophosphamide, how does it work? Alkylating agents, how do they work? If you study that, do revision of this, 200 baggage में questions में one question definitely आएगा. Regularly your score will improve by 1 mark if you have finished and kept in your pocket. मैं इसके पहले बोला ना बायोकेमिस्ट्री का साइकिल्स, उसको खत्म करे तो कंपलसरी 1 मार्क 200 में शुरू हो गया. हाइपोलिपिडेमिक ड्रग्स, लाइपोप्रोटीन एंड फेमिनल हाइपरलाइपोप्रोटीनेमियास, ये पढ़ लिए तो 1 मार्क पॉकेट में. अच्छा, 1 मार्क एवरी डे, 10 मार्क्स कंपलसरी टॉपिक्स को पॉकेट में डाल के जाओ रिविजन करते हुए. ये विदाउट एनी प्रिपरेशन ओनली यू आर गेटिंग 50%, 40-50%. With the preparation, reaching that 80% is all that what we want. We don't want more than 80% also, basically. Right. Now, with regard to multiple sclerosis, what is the definition of multiple sclerosis? The lesions are separated by geography. One cerebral artery demyelination, one spinal cord demyelination, one optic nerve demyelination, one cerebral cortical white matter demyelination. Spaced by time, spaced by geography defines multiple sclerosis. So first patient may present with altered gait. Within a few days, she develops blurring of vision because of optic nerve. Within few days, she will have a difficulty to walk because of the spinal cord involvement. Like that, it will be unfolding, separated by time. And if you look at lesions, they are all separated by geography. That is the definition of multiple part of the multiple sclerosis. Tumors of the CNS. Diffuse large B-cell lymphoma is the commonest type of primary CNS lymphoma. Now tell me, doctor, whenever a patient of HIV comes with a space-occupying lesion in the brain, what are the 2 closest differential diagnoses for that? One is toxoplasmosis, other is primary CNS lymphoma. If it is a primary CNS lymphoma, how do you make diagnosis? By doing brain biopsy. If it is a toxoplasma, you give pyrimethamine. So, do you prefer to try whether it is through brain biopsy or first you want to try pyrimethamine? So, always the rule is whenever there is a HIV positive patient presenting with a space occupying lesion, give a 3-week trial of pyrimethamine. If the lesion is regressing, then it is toxoplasma, tension 9. But if it is not, then you post him for brain biopsy and treat it as primary CNS lymphoma, is what you need to remember. So Medmix says, I am actually 3rd year, sir, following you from now itself. I hope I will reach a good rank in future. I am following your grantors every time. Very good. Medmix, I will check whether you paid fee or not. Right? But I'm so proud of you, Medmix, that you are from which medical college you are in 3rd year, doctor. I'm so happy to see you like that because you will be my companion for the next half decade, right? So one of the students in Karthik Medical College, first year, Dr. Timmer, right from first he used to call. So today I'm studying this, I'm reading this, I'm reading that. What do you say, sir? We were friends right from first year. Then he is MBBS, then he got MS General Surgery in Gandhi. He did MCS neurosurgery. Then he became a neurosurgery consultant. And later we both co-founded the Thinkers. So when I started Incus, he's my co-founder, my own student right from first year for almost 1.5 decade, became my business partner to build the Incus. So very good. Medmix, nice to see Guntur Medical College. Bring all your classmates first year to internship in Guntur Medical College to come and uh, what you call, I give you one uh, WhatsApp chat group for subscribing to the NEETPG mock test. So please ask all your friends, seniors, everybody to join through that, and then we will be more than happy for whatever a little discount price. We will try to provide you access to this core NEETPG app. So, doctor, 23-year-old cervical and mediastinal lymphadenopathy. Fibrous bands, effacement of lymph node architecture means what type of histology? Bharat, follicular lymphoma. Follicular nodular sclerosing type typically has got a very favorable clinical course. So this is the nodular sclerosis subtype. So this form of Hodgkin's lymphoma differs from all other Hodgkin's lymphomas. The most common in young women, relatively favorable clinical course is what you need to remember. So, lacunar cells are considered as the Reed-Steenberg cell variant, and the diagnosis of nodular sclerosis can be based on the fibrous bands in lacunar cells. Now, one question on leukemia, lymphoma. ఇది కరెక్ట్ చెప్పండి దీక్ష, వాట్ ఇస్ యువర్ ఆన్సర్? పట్టుమని చెప్పాలి. CLL में क्या होता है? A quarter century of online students are waiting what Diksha is going to tell in कौन बनेगा PG-पति program में. हम अमिताभ बच्चन बोल रहे हैं, दीक्षा जी आपका आंसर क्या होगा? आप तो ट्राई करके बोलो. Come on, guess one answer, quick. मैं रोज बोल रहा हूँ CLL, CML, ALL, AML and come on, Bharat, what is your answer? Autoimmune hemolytic anemia is a well-recognized complication of CLL, no doctor? CLL lo ఏముంటది? One of the autoimmune hemolytic anemias. So, lymphadenopathy is the feature of the disease, but most patients present with a full blood count. Incidentally, I don't know, the daughter-in-law took her father-in-law to get a blood smear done, and smudge cells are found, the broken lymphocytes, which are mature looking. That is how the presentation of CLL occurs. Now, conventional loss of courtesy between members of medical profession क्या होता है? Medical etiquette होता है. अभी सांप वाला आ गया. पूरा जब हमको इंडिपेंडेंस आए हैं, ऑल ब्रिटिशर्स, गोरे लोग क्या सोचा कि विंस्टन चर्चिल सेड, इंडिया इज ए कंट्री ऑफ फूल्स, इमोशनल फूल्स. यहाँ सांप पकड़ने वाला होता है. होल वर्ल्ड वाज थिंकिंग वी आर स्नेक चार्मर्स, राइट? सो हाँ, बट नीट पीजी एंट्रेंस में सांप को पकड़ना आना चाहिए. सो डॉक्टर, typically tail is compressed, belly scales which are large and cover entire breadth, usually nocturnal habit. नाइट में स्नेक आता है, वो पॉइजनस स्नेक, मॉर्निंग वाला वाटर स्नेक होता है. So all the differences between poisoning, non-poisonous snakes, every book you will have, but to read and remember and have it like a fun is important. The skull, pelvis, male versus female. Skull, pelvis, favorite question, doctor. So it is a Caucasian with a few Negroid characters is Indian. Showing which acid is called vitilic sulfuric acid. The sign of cellular death is rigor mortis, postmortem lividity, and flaccidity of the muscles. So once more, immediate is somatic death, early cellular, late is decomposition. Decomposition में क्या होता है? Mummification, adipocere, and putrefaction. Right? So still 20 pages forensic medicine बाकी है. हम पढ़ाएंगे one of the days. With regard to relative risk, so case control cannot be able to identify relative risk. Incidence among exposed by non-exposed into 100 is relative risk. Indirectly, it will do odds ratio. It can't directly calculate relative risk, case control. With regard to the live vaccines, so generally, live vaccines we don't give booster, right? Exception is OPV. Only OPV is the only live vaccine, though it is live, we give booster. Because live vaccines create are a multiplying organism, no? So that's the reason they know how to survive in our gut. To what extent the test accurately measures what it is purported to measure is called validity. Annual infection rate of TB in developing countries, every 1% of annual risk of infection, what is the corresponding figure? Correspond to 50 new cases of smear positive pulmonary TB per year for 1 lakh general population. Once more, doctor, leprosy, malaria, TB, dengue. Without them, there is no question paper. So if you do revision of this in SPM, what is the National Tuberculosis Elimination Program, NTEP, right? About malaria का क्या है? ये 4 पढ़ने से 1 मार्क आपके पॉकेट में जाएगा, right? एक मार्क पॉकेट में जाएगा. So we call that as 0.5% preparation. Means what, you know? 1 mark in 200 is 0.5%. मेरा तो 0.5% हो गया आज का. So 0.5% of improvement in your performance आने के लिए आप 1 घंटा स्पेंड करना पड़ता, बराबर. सो अगर आप 200 घंटे स्पेंड करें तो 100% रेडी होगा. So that is the reason you don't need more than 200 hours of preparation. Provided you know what are these 200 must to have in your pocket. Right? Adi focus ke dalwale. That is the whole purpose of this grand test. Now, Medmix is asking, sir, can I be perfect for my PG time by following this all through my UG, sir? Help me. Bah, you're too sincere student. Here there are students who started about 50 days back. Seriously, 1 month back. After finishing MBBS, आप तो 3rd year से शुरू किया, 1st year से फॉलो कर रहे हो. पीजी टाइम में क्या होगा? कुछ भी नहीं होगा, ऑटोमेटिकली आएगा. Probably you will get 210 correct out of 200. There is a risk of that. So enjoy, have a girlfriend, 1 or 2 at least, so that this time of NEET UG doesn't come back, Medmix. Right? So, okay, studies is anyway there, part of the game. So now, environmental factors in malaria. So once more, you should know, एनाफिलस शिमला में रहता है, क्यूलेक्स कलकत्ता में रहता है, कितना सी लेवल पे काउंट रहता है. अब्बा, anophelines are not found in altitudes about 2000 to 2500. So you go to Munnar for vacation, honeymoon, at least you don't get malaria, only you will get lavaria, right? So it won't exist at 2000 to 2500. So, according to the WHO, category 3 is 3 by 60. So once more, you should know all categories. 3 by 60, finger counting at 3 meters. 1 by 60, finger counting at 1 meter. So how do you define blindness, low vision, etc.? You need to be very sure about. Night పంపిస్తారా అది పంపించారు బర్డ్ PPTM బర్డ్. So what is the denominator in general fertility rate calculation? Mid-year female population age 15 to 44 who are in the reproductive age group. Once more, doctor, TFR, NRR, GFR, Pearl index, they're all the important keywords. So tonight, most likely tonight, last final check we are doing, there's one search button. So if you type Pearl index, immediately it will bring what are all the MCQs there and what are all the slides relevant to Pearl index. Then also it will index this Pearl index which you have searched in the history. So that every time you can go to the buzzword and then get the MCQs and this and then can do the revision. So that way we are the first in the world who is giving that kind of learning on demand. So take mock test, identify where you are going wrong, then just go and do the search and then get the questions and this thing about it and then prepare. Saturated fatty acid content is highest in palm oil, which is used to show the trend of events with the passage of time. Line diagram. With the passage of time, how Diksha's score is improving in NEETPG will be known by एक line diagram मारा क्या आप मारना फर्स्ट टेस्ट में कितना आया सेकंड में क्या आया कितना ऊपर नीचे जा रहा है otherwise I'll ask our people to build a line diagram for your part. Anyway, you know that who need to, there's no need of showing. So about chi-square test, it is very much used when more than two groups are to be compared. So it is basically the significance of difference between two proportions. When you compare between two mean values, what is that called? Mean value of one group with another mean value, you call it as? Very good. T-test. Excellent. Whereas if you compare proportions of a discrete variable, not a continuous variable. Continuous variables में mean value होता है एक population का, like weight, height and all that. वो दो means को compare करें तो वो T-test होता है, student T-test. Proportions को, how many said yes and no when they are asked that are you pregnant in one group versus another group. That proportions is basically compared by chi-square test. So the advantage of the chi-square test is more than two groups can be compared is what you need to remember. 820-point program is health for all. Once more, nowadays new questions are all what millennium developmental goals, everything. You remember na हम उसमें discussion किया SPM में. Then these are all absolute contraindications of OCP. Carcinoma, breast, liver disease, cardiac disease and all, but not migraine. So once more, doctor, what are absolute? What are relative contraindications? Perfectly as given in textbook and notes, remember karna. Exam hall में guess मत करना. Oh, I had migraine. I also took OCP. Maybe that is not a contraindication. तुम लिए तो that is problem with you. But you need to know absolute go relative, relative go absolute. Exam ना खेलेगा आपके जिंदगी से. So once more, OCPs, vasectomies, all types of tubectomies, and intrauterine contraceptive device. इसके बिना, that is 0.5% of your preparation is over if you mastered that. Now, thunderclap headache is a feature of subarachnoid hemorrhage. I never felt this kind of a headache in my life, doctor. When our patient says, nah, it is subarachnoid hemorrhage, immediately you need to evaluate. Beta 2 adrenergic agonist in the asthma. Generally, LABAs. Can you give me one example of a LABA? Huh? Somebody. Salmeterol. Salmeterol is a long-acting beta 2 agonist. So LABAs need to be combined with other agents. Then you can avoid steroids. So formoterol has a short time to onset. LABAs provide bronchodilation up to 12 hours. So one of the favorite questions is what? Exercise-induced asthma. Nocturnal asthma. For them, what is the best agent? LABA. Understand? Because it is long-acting beta-2 agonistic agent. Cause of transitive pleural effusion is nephrotic syndrome, constitutive pericarditis, mixed edema. So all transitive, exudative causes of the pleural effusion you need to be doubly sure about. ఐదు చెప్పండి ఒక హార్ట్ సౌండ్ లేకుండా పరీక్ష లేదు. So what is paradoxic splitting of second heart sound, Bharat? So basically A2 is first, P2 is next. Except miss అయిపోయినరా అబ్బా ఎట్లప్పా. A2 followed by P2. If there is a pulmonary hypertension, what will happen? P2 become prolonged and it become widened. Whereas if there is a left bundle branch block, what will happen? Closure of the LV depolarization become delayed. Because if there is a left bundle branch block, left bundle, right bundle need to finish its work and come and excite left side. So left side depolarization is delayed. That's the reason even the closure of the aortic valve also got delayed. It became so delayed after P2 that it lead to P2 come first. So that is the reason it lead to development of paradoxical second heart sound. Same thing is with LV failure. A failed left ventricle take longer to close the aortic valve. So that is the reason A2 become delayed beyond P2. Same also with aortic stenosis. With regard to coarctation of aorta, what is false? Come on. Usual presentation is systemic hypertension, severe heart failure. Some patients will have Turner syndrome associated with coarctation. That's the reason they will have webbed neck. So it can be associated with bicuspid aortic valve in 50% of patients, not MVP. Coronary artery disease, younger the onset in first degree relative, the greater the risk is there. So that is the reason just you being healthy is not enough. Make your cousins also come and play football with you regularly. If they get heart attack early, you are also ready for heart attack, right? So if there is any smoker, 1 year after quitting, the risk of coronary artery decreases by 50%. If you are not qualified for NEETPG last time, if you study 1 month with Dr. Murali Bharadwaj, the chance of you are getting government medical college A category seat is 90%. If you studied 3 months, I assure you, 100% chances are there. Provided 3 months you mean to be in game, every day you should come, right? So, what is wrong about rheumatic fever? Pyodermic infections don't lead to rheumatic fever, only throat infections will lead. Whereas glomerulonephritis can be caused by both streptococcal glomerulonephritis can cause by both skin and throat. How to evaluate hyperaldosteronism? So, typically, calcium channel blockers or alpha receptor blockers can be used to control the blood pressure during the time of while you are evaluating hyperaldosteronism. You should not use ACE inhibitors. That is the point. Okay? You should not use, because how do you diagnose primary hyperaldosteronism? प्राइमरी हाइपरटेंशन क्या होता है? किडनी के ऊपर एड्रिनल है, एड्रिनल में एडिनोमा है, वो क्या कर रहा है? बहुत ज्यादा अल्डोस्टेरोन का प्रोडक्शन कर रहा है, एंड बिकॉज ऑफ दैट रेनिन क्या हो गया? कम हो गया. So if you take aldosterone by renin, typically it become significantly increased. But if you happen to give ACE inhibitor, that can interfere your interpretation. Similarly, you give spironolactone, aldosterone receptor antagonist. How does spironolactone work as? Aldosterone receptor antagonist. So इसको भी बंद करना है, नहीं तो ये इंटरप्रिटेशन में दिक्कत होगा. ठीक है? So that is what you need to remember. What is the earliest and highly reliable indicator of iron deficiency? Always ferritin. Ferritin less than 12. So what is 0.5% topic? IDA versus anemia of chronic disease versus thalassemia versus sideroblastic anemia. 1.5%, 1 mark आ गया पॉकेट में. बराबर? डाययूरेटिक्स का टॉपिक पढ़ो, नेफ्रॉन फिजियोलॉजी पढ़ो, 0.5%, 1 मार्क आ गया पॉकेट में. ये दोनों आज रात को पढ़ो, 1% ऑफ योर प्रिपरेशन इज ओवर. ठीक है? सो विटामिन B12 मेटाबॉलिज्म, इट इज अ ट्रांसकोबालामिन 2, not 1, 3. Sorry, 2, which is capable of transporting vitamin B12, not 1. With regard to cytogenetics of Hodgkin's lymphomas, once more, a cytogenetic abnormality, CD receptors, a बहुत बड़ा झंझट है भैया. So, chromosome 8 and 4 are being identified. The proto-oncogene C-Myc is translocated. T14-18 translocation is characteristic, and BCL2 is overexpressed in follicular lymphoma. मैंने क्या बोला? इसका आंसर बोलो. मैं रोज वही बोल रहा हूँ, आप सुन रहे. मल्टीपल माइलोमा, वाल्डनस्टॉम्स మైక్రోగ్లోబులినిమియా, ఎంగస్. ఇప్పుడు చెప్పండి, ఇది ఆన్సర్ చెప్పకుంటే నేను భూతయ్యా. Come on, Diksha, what is your answer?
Option B is false.
Huh?
A, C and D are correct, sir.
A, B, C, D. A the answer.
B.
Very good. You said B?
Yes, sir.
Exam में तप रासावा अब्बा. बोल ले. At least you understood, right? My world. So light chain is deposited. It is the IgG. Garam. Then false about variceal bleeding is, under normal circumstances, there is 2 to 6 millimeter mercury difference between portal vein and IVC. So approximately 50% of the cirrhosis patients have esophageal varices. But if they survive one bleeding episode, they have 60% chance of the recurrence. मैंने क्या बोला? Hepatitis B, hepatitis C virus, viral hepatitis, 0.5%. Preparation is over if you read this. 1 mark आपके Pocket mein jaya. So once more, you should know, doctor, what is meant by low viral replication. The moment HBE develops, envelope antigen ka, then it is not replicating. Chronic because it is IgG. This is acute because it is IgM. And this is vaccination because anti-HBs has developed, uh, okay, and anti-HBs must be positive. Hmm? Hmm. So once more, this is the important table, doctor. Uh, you need to remember interpretation, right? How do you do the interpretation? These are all the etiological factors of pancreatitis. So, pancreatic division, smoking. Last question DA, sir. Huh? Last question. Apple ఏమైంది లాస్ట్ క్వశ్చన్ యాపిల్ సి అని ఇచ్చినారు ఆన్సర్ ఉందా పాజిటివ్ అని సి ఆన్సర్ కరెక్ట్ అని ఇచ్చినారు
ఆప్షన్ సి అని కరెక్ట్ ఇచ్చారు ఆప్షన్ డి
ఆప్షన్ సి అనేది
యాప్ లో టెస్ట్ రాస్తే అది ఆప్షన్ సి ఇస్ కరెక్ట్ అని ఇచ్చినారు
సి ఆన్సర్ ఏదంటున్నాడు డి అంటలే డి అన్నాడా యాక్చువల్గా ఇది రాంగ్ డి ఆహా ఇది పాజిటివ్ ఇచ్చిండు యాంటీ హెచ్బిఎస్ యాప్ ఈస్ రైట్ ఆర్ దిస్ ఈస్ రైట్ దిస్ ఓన్లీ రైట్ నో okay okay but anyway you know this story right now what are the etiological factors for pancreatitis? Smoking, pancreatic ampullary neoplasm, pancreas division, they're all the risk factors. With regard to rheumatoid arthritis, very early stage only it will involve sacroiliac. Any young man comes with a severe back pain, 35-year-old, you should always evaluate possibility of ankylosing spondylitis, right? So, once more, what type of joints are involved? Tip joints are involved in rheumatoid arthritis. But dip joints are involved in only two conditions. What are they? Only two conditions may distal interphalangeal joint is involved. Osteoarthritis and psoriatic arthritis. ఈ రెండిట్లనే డిప్ ఇన్వాల్వ్డ్ వేరే దేంట్లో డిప్ ఇన్వాల్వ్డ్ కాదు విచ్ ఇస్ ఏ ఇన్ఫ్లమేటరీ ఆర్థరైటిస్ విచ్ డోంట్ షో ఇరోజన్స్ బతికిష్టం ఇవాళనే ఇంటికి పోయినాక డాక్టర్ గౌటీ ఆర్థరైటిస్ ఆస్టియోఆర్థరైటిస్ రుమటాయిడ్ ఆర్థరైటిస్ and ankylosing spondylitis, seronegative arthropathies. Seronegative arthropathies. What are the pair seronegative arthropathies? P for psoriatic, A for ankylosing, I for inflammatory bowel disease, and R is Reuters. Okay? आज रात ही आप पढ़ना है. Once more, SLE is one topic, 0.5% preparation. 1 mark आएगा. It is the dsDNA, anti-dsDNA, where that correlates with the disease activity, not anti-Smith. But anti-dsDNA and anti-Smith are specific antibodies. Regarding, once more, acid-base disturbance is a favorite question, doctor. Acid-base disturbances. So, regarding metabolic acidosis, what is the correction that suggests metabolic alkalosis? So metabolic alkalosis occur in to correct the respiratory acidosis. So respiratory acidosis is identified by increased PCO2. Alkalosis is identified by the correction will cause bicarbonate to increase. So how can that be lower than should be higher than? Because compensation concomitant metabolic alkalosis is identified by a higher bicarb, not a lower bicarb, right? Then paresthesia with Jacksonian march is a feature of simple partial seizures. ఇది తప్పు పెట్టకూడదు. एपिलेप्सी एंटी एपिलेप्टिक ड्रग्स एक पॉकेट में डाल दो 0.5% प्रिपरेशन खत्म हो गया. पार्किंसोनिज्म पढ़ा, पार्किंसन ड्रग्स को पढ़ा, वन मार्क 0.5% ऐड हो गया. मिग्रेन एंड मिग्रेन ड्रग्स को पढ़ा, 0.5% प्रिपरेशन इज ओवर. रोज एक 2% इंप्रूव हो जाना है डॉक्टर. 50 डेज में आप 100% हो जाओगे रेडी फॉर एग्जाम. इंप्रूवमेंट मीन्स आज पढ़े तो कभी नहीं रॉन्ग करना. For whatever the reason, you need to wait, look for it and attack it. Also about lacunar infarction, once more cerebrovascular accident, all the brainstem strokes, MCA stroke, ACA, PCA stroke, then Wellenberg syndrome, Mannu Mashanam Anta Dadvale, Reddit Chundala examiner. CVA is the favorite topic. We discussed it very detailed in the score app. So for the online students, remember doctor, please subscribe today only for 70 full scale grand tests and discussion. Join this WhatsApp study group and we will reach out to you and help you to subscribe at a very discounted price. So with regard to lacunar infarct, less commonly deep cerebral white matter. Typically basal ganglia, pons, cerebellum, anterior limb of the internal capsule is the one which is involved by lacunar infarcts. Intracranial tumor, cerebellar astrocytoma has a more benign course. So glioblastoma multiforme, astrocytoma, medulloblastoma. Where do you find drop metastasis, which are drop and spread through CSF? Medulloblastoma, classically. So once more, doctor, brain tumors is one seat guarantee topic. Gliomas, astrocytomas, medulloblastomas, everything you need to be very, very sure about. Hyperparathyroidism. Hyperparathyroidism lead to hypercalcemia, right? And PTH normally stimulates renal tubular reabsorption of calcium. But hyperparathyroidism causes so much of hypercalcemia that it is beyond the resorptive capacity of the tubule, so that it will appear in urine. So high urinary calcium with a high plasma calcium together same time happening is hyperparathyroidism. But otherwise parathormone का function क्या होता है? Calcium reabsorption and phosphate loss into urine. So normally it lead to hypocalciuria and hyperphosphaturia, but not when it is primary hyperparathyroidism. Will you remember this? Remember the difference? Cushing's syndrome. So typically Cushing's syndrome have leukocytosis with relative granulocytosis and lymphopenia. Always steroid का effect क्या होता है? Leukocyte count को shoot करेगा. That's the reason you need to be very careful. Suppose if a bronchial asthma patient you give steroid, and that steroid led to pneumonia. Normally, pneumonia is identified by leukocytosis in CBP. But already, if you have given steroid, it is difficult to interpret the complete blood picture because steroid by itself lead to lymphopenia and leukocytosis. 14,000, 15,000 chale jayega. You don't know whether this is due to pneumonia or whether it is due to steroid. What is wrong about type 2 diabetes? So type 1 versus type 2 अगर आप लिए तो HLA association is a feature of type 1 but not type 2 is what you need to remember. With regard to purulent meningitis of unknown cause, if there is an impaired cellular immunity, then it is the pneumococcal pneumonia, pneumococcal meningitis, which is much more Streptococcus pneumoniae, Listeria, gram-negative bacilli. They are more often underlying cause for the impaired cellular immunity. Once more, doctor, remember, pneumonia, etiological factors, meningitis, etiological factors, neonatal septicemia, etiological factors. Compulsory one question will come, mark my word. So cells in the immune network of that are infected by HIV include macrophages, B lymphocytes and helper inducer lymphocytes. Major criteria among modified Dukes criteria include all except oscular node, rod spots, they are not included in the major. So what is major, what is minor, you need to be very, very sure about. So rod spots, oscular nodes, they are all part of the minor. Between oscular node and JNV lesions which are painful, గురుగారు మీరు మా బెట్టింగ్ హార్స్ అంటే మీ మీద ప్రెషర్ ఎక్కువ ఉంటుంది. ఇట్స్ లైక్ విరాట్ కోహ్లీ ఎక్స్పెక్టెడ్ టు బి పర్ఫార్మింగ్, రైట్? సో ఇన్ఫెక్టివ్ ఎండోకటైటిస్ నువ్వు ఇవాళ ఇంపోజిషన్ రాసి పట్టుకురా రేపు. कंपल्सरी पूछेगा इन्फेक्टिव एंडोकार्डाइटिस में. रिमेंबर, oscular nodes are painful. How you will remember? Painful cervical os. JNV lesions are painless. ठीक है? With regard to Hansen's disease, Mycobacterium leprae never grows on artificial media. Bronchogenic carcinoma. Small cell carcinoma arises from bronchus, but it won't form any luminal mass. That's the point. మళ్ళీ రాసుకోండి డాక్టర్ గారు, పారనియోప్లాస్టిక్ సిండ్రోమ్లు అండ్ లంగ్ క్యాన్సర్, బ్రెస్ట్ క్యాన్సర్, ప్రాస్టేట్ క్యాన్సర్, ఎండోమెట్రియల్ క్యాన్సర్, సర్వైకల్ క్యాన్సర్, ఇవి కంపల్సరీ డాక్టర్ గారు. ఇవి 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 ప్రిపేర్ కాకుండా పరీక్ష పోతే ప్రిపేర్ కానట్టే లెక్క. అండ్ విత్ రిగార్డ్ టు హైపర్ క్యాల్సిమియా, typically in patients with breast cancer, myeloma or lymphoma, hypercalcemia does not invariably indicate a dismal prognosis. Once more, what will you remember? Hypokalemia, hyperkalemia, hypomagnesemia, hypercalcemia, hypocalcemia, ECG findings, causes, hyponatremia, hypernatremia. ఎన్నైనా మొత్తం 1, 2, 3, 4, 5, 6, 7. All the 7 what lead to central pontine myelinolysis, how to do the correction of sodium, and how do you calculate the sodium deficit, which lead to QT prolongation, QT shortening, which lead to tall T waves, which will lead to T wave inversions, which will lead to P become prominent and P become absent. ఇట్లా గర 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 తిప్పిపోవాలి పరీక్షకి. ఫుల్ టర్మ్ మేల్, నార్మల్ స్పాంటేనియస్ వెజైనల్ డెలివరీ, appeared well until 3 weeks. So all that story talks about a late onset group B streptococcal meningitis and sepsis doctor. Right? The most appropriate next step investigation obviously is CSF analysis. So asthma is transferred with lung transplantation. If you get a lung of a asthmatic patient, you will also start wheezing, which you never do in the life. Asthma is present but not consistently among monozygotic twins. That means that called what concordance and discordance studies. What is the meaning of concordance and discordance studies? So typically, when you take genetically identical individuals grown in different environment, राम श्याम हिंदी मूवी में एक पुलिस ऑफिसर बनता है और एक चोर बनता है, दोनों राजेश खन्ना होता है, राइट? सो different environment when you expose, if they differ in showing expression of disease, then they are having discordance. That means genetics has less influence, but environment has more influence. So a plastic surgeon को 4 बच्चे हैं, एक बना प्लास्टिक सर्जन, दूसरा बना कारपेंटर, तीसरा बना बार्बर. Anything is cutting only. Another became forensic guy, finally cutting dead bodies. So अब्बा एक ही है, मगर बच्चों तो अलग अलग लेवल पे बड़ा हुआ. मतलब to become a plastic surgeon, environment has more influence than genetics. The reason is this guy who did plastic surgery attended Murli Bharadwaj coaching. Right? So east or west, our mock tests are the best. So 3-year-old boy with 7-day history of fever, cervical adenopathy, foul breath, first generation cephalosporin. So what is the most likely diagnostic test of it? He has a herpetic gingival stomatitis, auto-inoculated by sucking the thumb, and has developed herpetic whitlow. If you look at the whole story. 12-year-old with recurrent wheeze required 10 separate courses of prednisolone. Every time prednisolone is tapered, the child develops an exacerbation. There is a marked eosinophilia. What is your diagnosis? A, B, P, A. Allergic bronchopulmonary aspergillosis. Once more, this has certain diagnostic criteria. Major, minor criteria are there in ABPA. Please do revise this thing. And prednisolone is the treatment of choice. Normally, SVT. How do you recognize SVT versus VT? Narrow complex tachycardia is SVT. Broad complex tachycardia is VT. So, if you do vagal maneuvers like carotid massage, SVT resolves because your vagal maneuver will lead to AV nodal refractoriness and prevent the SVT going to ventricle. Whereas VTs which are there happening in the ventricle itself, they don't respond to your vagal maneuvers that are causing AV node become refractory. So that is the reason you need to identify whether VT or SVT. Accordingly, treatment is decided. If it is SVT, then you will try vagal maneuver. If not, adenosine is the treatment of choice. Whereas if it is a VT, you look whether he is hemodynamically stable or unstable. If he is unstable, then you need to do DC cardioversion. If he is stable, then you can give lignocaine, amidaron, etc., etc. So, Chaudhara, VT, SVT, lekunda question paper laid with that. Every question paper has VT, SVT, which you need to be doubly sure about. A previously well 3.5-month-old presents with poor feeding, diaphoresis during feeding. Respiratory rate is 70 is too high, no? 30 or 40 is okay. 70 and I mean, a chest radiograph shows cardiomegaly. There's a holosystolic murmur, mid-diastolic rumble are noted. palpable parasternal lift and systolic thrill. అన్ని ఏం సజెస్ట్ చేస్తాయి? VSD. Why there is a mid diastolic rumble in VSD? VSD में क्या हो रहा है? Left atrium pumping blood into left ventricle is pumping into right ventricle into pulmonary artery into pulmonary vein, and once more blood is coming back to लेफ्ट एट्रियम. सो लेफ्ट एट्रियम को कंफ्यूजन हो रहा है. कई को ये ज्यादा ब्लड मुझे रिटर्न हो रहा है क्योंकि भैया फ्लिपकार्ट ने आयोटा में डिलीवर करने वाला बंडल को राइट वेंट्रिकल में डाल दिया. तो एनी इंक्रीज्ड फ्लो अक्रॉस नॉर्मल वाल्व और ए नॉर्मल फ्लो अक्रॉस डैमेज्ड स्टेनोटिक वाल्व, एनी ऑफ देम विल लीड टू murmur. So when will this murmur is produced? All this increased return is flowing into ventricle when the ventricle is undergoing diastole. So that is the reason you find a mid diastolic rumble. చెప్పండి ఎందుకు వస్తుంది?
When the flow goes through abnormally through a normal valve or normally through an abnormal valve.
Agreed. So from left ventricle through VSD, it went into right ventricle. Normal supposed to go into aorta, left side. But it has gone into pulmonary artery, pulmonary vein, and returned back to left atrium. Left atrium. So regular pulmonary venous return plus this shunted blood together is too much blood coming to left atrium, crossing a normal valve. So that lead to increased flow across normal valve, lead to diastolic murmur, which is mid diastolic murmur. समझ में है? Or am I too fast?
Basically, it's like MS only, but in MS there is normal flow. Here it is abnormal flow.
అది కానీ ఇంక్రీజ్డ్ ఫ్లో ఎట్లా వచ్చిందో ఏర్పడే కదా మీకు లెఫ్ట్ టు రైట్ షంట్ లో. Neonate is going to benefit from platelet transfusion. Who is that one? The one who is on ventilator for severe respiratory distress and a low platelet count. So thrombocytopenia in sick neonates due to any condition places this neonate at risk of developing severe intracranial bleeding, and thus risk is greatest with ITP-like conditions, isoimmune thrombocytopenias. Asymptomatic 10-year-old girl with spleen edge palpable 3 centimeter below the left costal margin. The best next test to evaluate spleen is always abdominal ultrasonography is the best screening test because no radiation risk. Patient is newly diagnosed with ALL, has WBC count of 1 lakh. Laboratory show blood urea nitrogen elevated, creatinine elevated. What is the cause in leukemia? When the patient develops hyperuricemia, renal failure, tumor lysis syndrome. So how do you treat precocious puberty? So precocious puberty is because of too much of LHFSH, very prematurely. Normally, the gonadotropin releasing hormone will prevent LHRH from released. That prevents puberty starting. The moment GnRH production begins in hypothalamus, LHFSH will become released and that lead to onset of puberty. So यहाँ क्या हो गया? If you give GnRH analog continuous instead of pulsatile, you are inhibiting the endogenous GnRH. So that will treat the precocious puberty. అర్థమైందా? నాకు కొంచెం డౌట్ వస్తుంది, నేను చెప్పేది అర్థమవుతుందా? అయితేదా క్లియర్? If simple rule, if I understood, you understood. If I tell something that I myself don't understood, you don't understood. Right? Good to see Swati and many more who are all online. Energy petrol 1 hour 24 minutes हो गया. Very good. 9:30 batting is with them, huh? Is it fine, Bharat? 9:30? So leprosy is not highly infectious. కొంచెం దీంట్లో చూడండి యూట్యూబ్లో. ఏం ఆన్ చేయను? మై హాట్స్పాట్ ఈస్ దేర్. ఓకే, ఉంటేనే కదా దీంట్లోకి వచ్చేది. దాంట్లో హాట్స్పాట్ ఉంటేనే కదా దీంట్లో వచ్చేది. ఓకే, లేకపోతే యూ పుట్ యువర్ ఫోన్. All right. Meanwhile, you can check through the YouTube, right? Now, with regard to the dermatophytosis, never dermatophytes involve oral mucosa. If there is any mucosal involvement or red scaly skin rash, then you think of candida, not dermatophytosis. So, tinea infections, there is a central clearing of the lesion and blister formation can occur. They are all true. Now, with regard to lichen planus, it is the flexor surfaces of the upper extremities, not extensor, where you see the lichen planus. Plaque psoriasis, typically circular to oval red plaques, typically distributed over extensor body surface. And acute flares, relapses of plaque can become erythrodermic psoriasis very much. Anti-desmoglein antibodies, come on. What is your answer, Diksha? Anti-desmoglein antibodies are a feature of? Bulla, sir?
No. Pemphigus vulgaris only. Hemidesmosomes is bullous pemphigus.
Mare. ఎట్లా డాక్టర్? పెంఫిగస్ వల్గారిస్, బుల్లస్ పెంఫిగాయిడ్, డర్మటైటిస్, హర్పిటిఫార్మిస్, మూడు త్రిమూర్తులు, బ్రహ్మ విష్ణు మహేశ్వర్. Definitely one question आएगा. Absolute contraindication for central neuraxial blockade. This is a favorite question of the examiner, doctor. Epidural block है सबका, central neuraxial block, spinal block. What are the absolute relative contraindications? So I only leave you the literature, doctor. What are the absolute and what are the relative contraindications for central? Will you remember this particular slide? आप याद रखना. 30-year-old female to undergo regional anesthesia for her trigger finger. So always finger anesthesia में ఇది కూడా పోతుంది. ఇప్పుడు చేంజ్ చేసిన నీ ఫోన్ పెట్టు వైఫై. Good. So always finger is what digital end vascular supply. So అక్కడ కనుక మీరు ఎనీ వాసోస్పాస్టిక్ ఏజెంట్ ఇచ్చారనుకోండి, it lead to infarction. So that is the reason you should not use bupivacaine for that purpose. Bupivacaine is typically associated with, it is not preferred. Okay, now Tauhe's needle is used for epidural analgesia. MAC is highest for N2O. Higher the MAC, how is potency? Lesser the potency. So these are all the values, doctor. N2O has 104% MAC. Methoxyfluorine has only 0.16%, which is lowest. With regard to isoflurane is used in neurosurgery. You remember? నేను ఇవాళ ఒక వీడియో వేసిన old video, all anesthetics side effects. Hmm. Rapid cycling of bipolar disorder, when you call 4 or more mood episodes are there in 1 year, you call rapid cycling. So everything about lithium you should know, doctor. Lithium lead to the leukocytosis, not leukopenia. It lead to polyuria, polydipsia, because lithium is known to lead to diabetes insipidus. 48-year-old felt sad since her adolescence. She does not remember the last time she did something fun. That's the reason have a little fun in the life. Always NEET PG preparation will make you sad. She denies any suicidal thoughts. Because she denies suicidal thoughts, it doesn't meet the criteria to be called as major depression. So what is the diagnosis? And there is an impaired sleep pattern. This is the definition of dysthymia, is what you need to remember. Which is the drug of choice for long-term treatment of panic disorder? SSRIs. If SSRIs is an option, SSRIs is the answer. అది రూల్. తర్వాత మళ్ళీ అన్ని చదవాలి డాక్టర్ గారు. ఫ్లూఆక్సిటిన్, SSRIs, SNRIs, then OCD, personality disorders, compulsory. So a personality disorder guy don't have a insight. We think our father, our dad has a personality problem. He never listens to how much he's hurting you, right? But he was like that from childhood, right? One of your roommate is bullying, but he is bullying right from his school days. Bullying is a part of his. He doesn't have insight or any guilt also for doing that. So personality disorders में कभी भी insight नहीं रहता. Patient is excessively preoccupied with details listed organization is OCD. He is inflexible. So their obsession compulsions are egosyntonic, not dystonic. That is the reason they lack insight. 65-year-old mammogram shows multiple well-defined soft tissue opicities. Which primary? It is lymphoma, melanoma, ovarian carcinoma, and lung carcinoma in that order of frequency metastasize to the breast. What is the cause of vertebra plana? It is the osteogenic sarcoma is not the cause. TB, metastasis, and eosinophilic granuloma will flatten the vertebra vertically. Can you see? Vertebra plana. 35-year-old undergoing investigation of hypertension and impairment demonstrated with ultrasound has multiple bilateral renal cysts, hepatic and pancreatic cysts. What is the diagnosis? ADPKD. About curly B lines, they are due to thickening of the septum horizontal and due to pulmonary venous hypertension. It is not curly B but curly A lines that run from hilar area to periphery. A patient has mitral stenosis, what will he show? Lifting up of the bronchus, double atrial shadow. What is meant by double atrial shadow? Shadow within shadow. So whenever the left atrium enlarges, it enlarges towards the right side. So that along the right heart border, you find double shadow, which is called shadow within shadow appearance. And there's a posterior displacement of esophagus because left atrium is a posterior located. Whenever it enlarges, it will cause trachea, esophagus, everything get affected. Retrosternal shadow means what? Anterior chambers, like your right ventricle or right atrium enlargement will lead to a retrosternal shadow. Infantile hypertrophic pyloric stenosis, it is associated with projectile non-bilious vomiting. Crispin's disease may you find hypertrophic nerves, not atrophic nerves. Medium risk for DVT. Once more, DVT is divided into low risk, medium risk, high risk. You need to know what are all the causes of low risk, medium, and high. Fast is not good for penetrating injuries. It is only good for blunt injuries. In burns, more than 15% will lead to shock. Look at the graft anatomy. Thicker grafts cause greater contracture. Once more, grafts, doctor, please remember. Burns, grafts. What are the different types? Partial thickness, full thickness graft, wolf graft is what, Thiersk graft is what, everything 100% ready for the exam. Salivary gland tumors. So, parotid is the most common site, and painless swellings below the ear, in front of the ear, or in the upper aspect of the neck is the most common presenting feature, not within the cheek. Thromboangiitis obliterans means physiologically there will be no atherosclerotic changes. If there is atherosclerosis, it is atherosclerosis. So, non-atherosclerotic, non-diabetic, non-hypertensive, smoker is the patient who developed the thromboangiitis obliterans. स्मोकिंग हिस्ट्री हो या एथेरोस्क्लेरोसिस है, डायबिटीज है, हाइपरटेंशन है, उसको थ्रोम्बोएंजाइटिस ऑब्लिटरेंस नहीं बोलते.
Third option is also wrong, sir. Young male, less than 40 years old. So same.
C, D. Here more of thrombophlebitis will be found, usually under 30. So it should be C, D. Both of them should be correct. So with regard to hernias, elderly people में जो होता है direct inguinal hernia because there is abdominal muscle weakness. So Hazelback triangle में weakness आ जाएगा. Through which herniation occur? So once more, femoral hernia, direct and indirect inguinal hernia, Richards hernia, all hernias, one hernia होगा, नहीं तो hydrocele होगा, नहीं है तो वो NEETPG नहीं होगा. Barrett's esophagus. Apply किया क्या दीक्षा? मेरा application है, చేసేయండి వాళ్ళ. Finished? Application fast గా. ఎక్కడ సార్ 40% 50% మార్కులు వస్తున్నాయి, యాడ్ అప్లై చేయమంటారని కూర్చోకండి, చేసుడే 50 రోజులు ఉంది డాక్టర్, 50 రోజుల దుర్నిధులు చదవచ్చు. సో యు ఆర్ ఆన్ టైమ్ టు క్యాచ్ ద ఫ్లైట్ టు పీజీ. లెట్ మీ టెల్ యూ, Barrett's is a metaplastic change, not a dysplastic change. Carcinoma of the esophagus, lymph node involvement is very much a prognostic factor. It is a bad prognostic factor. So all these are precancerous. Gastric ulcers, not duodenal ulcers. So gastric malignancy में क्या होता है? Trocheus sign, thrombophlebitis, superficial thrombophlebitis is the classical feature. The Strozier sign, left supraclavicular lymphadenopathy is metastatic. Surgical approach to hepatocellular carcinoma, adjuvant chemotherapy does not improve the prognosis. In case of hepatocellular carcinoma में remove करने के बाद अगर आप chemotherapy दिए तो फर्क नहीं पड़ता. Anatomy of the spleen. From where does tortuous splenic artery arise, doctor? It is from the celiac axis and runs along the upper border of the body and tail of pancreas. With regard to the gallstones, pain is non-colicky. Right upper quadrant are epigastric pain which may radiate to back. More often it is dull and constant. That's the point. Unlike biliary coli, it is negotiating through a duct means like ureteric stone also it is passing through a tunnel, no, that lead to colicky pain. Hereditary pancreatitis. It carries a very high risk of developing pancreatic cancer. Which state of India hereditary pancreatitis is very high? Kerala. Hmm? Then ulcerative colitis. Smoking protects, not predisposes. Not to COD15 gene has a strong association with Crohn's disease. Once more, UCCD, 1 mark, 2 marks. So your preparation is 0.5% over if you read these two topics. Adenomatous polyps. It is the villous adenoma, not tubular adenoma, that will lead to hypokalemia. With regard to the genetics of carcinoma colon, so you should know APC mutations are there in 2/3 of colonic adenomas. KRAS mutations result in activation of cell signaling. KRAS is in the later events in the mutagenesis. APC is involved in the earlier part of the mutagenesis. Postoperative adhesions. Typically covering the anastomosis with raw peritoneal surface prevents the postoperative adhesion. Thyroidectomy. Colloid goiter may never do subtotal resection. You do total resection, otherwise it lead to recurrence. That's a funda. Once more, doctor, Graves' disease, different types of thyroiditis, in which radionuclide scan increases, decreases uptake, diffuse uptake, LATs, long-acting thyroid stimulating antibodies, where do you see? And if it's a young patient below 45, how do you treat radioiodine or surgery? More than 45, do you give radioiodine or surgery? Ammo. సంపి చదవాలి థైరాయిడ్లా ఈ టాపిక్లు. అట్లనే థైరాయిడ్ కార్సినోమా డాక్టర్, కిల్ ఇట్, పుట్ పెట్రోల్, బర్న్ ఇట్, ద టాపిక్, because 0.5% preparation is over if you read that. So if papillary carcinomas are encapsulated, still you can't consider them as benign. Breast carcinoma. E-cadherin antibody reacts positively in lobular. What is the specialty of lobular? It is bilateral, poor prognosis. That is the story. Renal caliculi. It is the decreased urinary citrate that predisposes to renal caliculi, not increased urinary citrate. So, whenever citrate is there, it tends to keep otherwise insoluble calcium phosphate and citrate in solution. अगर citrate नहीं है तो क्या हो जाता? If the citrate is not there, calcium precipitates. Okay? And where is citrate released? Proximal convoluted tubule is responsible for creating some significant amount of citrate in tubular fluid. Gravit's tumor is the other name for renal carcinoma. It's a renal adenocarcinoma, most common neoplasm of the kidney, arising from renal tubular cells. So it is the upper pole, lower pole from which it arises. It is the urothelial carcinoma is the most common histology of bladder carcinoma. If you look at surgical anatomy of the prostate, the glands of the peripheral zone, right? They are lined by columnar epithelium. They lie in the fibromuscular stroma. Their ducts are long and branched, and they open into the posterolateral groove on the either side of the verumontanum, prostatic urethra. So where does BPH start? it starts in the periurethral transitional zone. Periurethral transitional zone. Lymphatics in the medial side of the testis drain into the node which is there at the bifurcation of common iliac artery. With regard to the rickets, proliferative zone by name itself is active. Inactive ante chiller question adi. Easy, biscuit question. With regard to unicameral bone cyst, it is the proximal humerus, not distal humerus, where it is being found. Osteogenic sarcoma. ESR is raised. Long bone metaphysis is the location for osteogenic sarcoma. Malla, bone tumor. When you go to the exam, no? Ewing's, giant cell, osteogenic sarcoma, fibrous dysplasia. किसके साथ मैं खेलूं आज? Is it chondrosarcoma? Is it osteoblastoma? That is how you need to attack examiner. Bone tumor आ गया, मुझे डर लग गया, मेरा tachycardia हो गया, मैं confused except नहीं दिखा मुझे, कुछ भी नहीं, तुम नहीं पढ़ा, वो सच है, right? So bone tumor, you finish, you only take about 1 hour. I have given a clear notes in orthopedics. You clear it, then you get 1 mark assured. Traumatic anterior instability usually follows acute injury when the arm is forced into abduction, external rotation, and extension. Most common site of skeletal TB, spine. Congenital dislocation of the hip. Unilateral dislocation cause asymmetrical creases. Galiazi అంటే ఏం చెప్పుకోరు, మనం తప్పు చెప్పినావు. 2 నీ జాయింట్ ఇట్లా మడతపెట్టి పిల్లోడు అనుకున్నాడు, ఇది కాలు, ఇది తోడ, ఇది కాలు. So you flexed, hip level में flexion किया. So a knee joint and another knee joint you compared. One knee joint is at higher level than the other. That is called Galeazzi sign. Once more, CDH, CTEV, CDH, CTEV, pes cavus, then coxa valga, slipped capital epiphysis. One question comes, doctor, 0.5% preparation. A vascular necrosis is a complication of lunate following dislocation, body of the talus after fracture of the neck, head of the femur after dislocation of hip. And it is the proximal part of the scaphoid after the fracture through its waist, not the distal. Supracondylar fracture. The distal fracture fragment is displaced. Where is it displaced? Either posteriorly or anteriorly. Either anteriorly or posteriorly. Proximal fragment can injure brachial artery. Proximal fracture can injure median nerve. Posterior angulation or displacement of distal fragment suggests hyperextension injury. Otherwise, it is flexion injury if it is anteriorly displaced after supracondylar fracture. Malla, Dr. Garu, Colles fracture, Smith fracture, supracondylar fracture, Galeazzi fracture, Monteggia fracture, Oka fracture, humerus fracture. Humerus la malla shaft fracture, neck fracture. 5 ఫ్రాక్చర్లు చదవడానికి 5 పదులు 50 పాయింట్లు. 50 పాయింట్లు అంటే గంటల ఖతం చేసేస్తే మీకు ఒక 0.5% preparation over. Right? Now, doctor, with regard to Jefferson's fracture, there is no neural encroachment in Jefferson. Is Jefferson is atlas or axis? Come on, doctor. Top of the head, sudden severe load on the top of the head may cause a bursting force. which fractures the ring of Atlas. Atlas enti first cervical vertebra. You can remember Jefferson and all the Adam, Jefferson, Washington, ilante evaru first presidents of America. So Jefferson first atla gurtu pettukondi. Atlas vertebra involvement is Jefferson. Hangman's fracture is C2 axis. And how do you see this C1 ring fracture? Open mouth view. Posterior dislocation, steel belt restraints can reduce the number of because it's a dashboard injury, no? When you move forward and hit the dashboard with your knee joint, you will get posterior dislocation. And it is the FADIR, flexion, adduction, internal rotation, not external rotation. With regard to anatomy of the eye, so its peripheral recess is called angle of anterior chamber. It is bounded posteriorly by the root of iris and ciliary body, anteriorly by the corneosclera, the angle. So, ठीक है डॉक्टर? Ciliary body पीछे रहता, cornea scleral junction आगे रहता, anterior रहता. अगर आप वो angle of angle को देखें तो. What are the three basic areas on which Vision 2020 focuses on? Creating a foundation of well-trained eye care workers, underprivileged areas, implementing specific programs to treat blindness. Fluorescent angiography. Typically, capillaries in the retina are relatively impermeable so that practically no colloid molecule can pass unless there is inflammatory condition leading to the leakage. With regard to the genetic transmission, once more, inheritance pattern is a favorite question, doctor. So tell me, if the person is heterozygous for autosomal recessive partners a normal person, then 50% of their offspring will be carriers. Ek dal dena. Heterozygous, married a normal guy, normal person. What will happen? A. तो क्या हो गया? So 50% are carriers. No need of bugging. There only you can calculate. So photoreceptors, when they are being stimulated, how do they transmit the signals, doctor? Bipolar cells. Once more, magnocellular pathway, parvocellular pathway, photoreceptors, retinal ganglion cells, and how does light generate is a favorite question. Headache के differential में क्या होता है? Generalized non-descript band-like discomfort is a feature of tension headache, not cluster headache. పరీక్షకి టెన్షన్ వస్తే టవల్ చుట్టుకుంటావు కదా, బ్యాండ్ లైక్ headache. Age more than 55, raised ESR with jaw claudication with scalp tenderness, giant cell arthritis. Decreased vision, painful red eye, dilated vertically oval pupil with a shallow anterior chamber, angle closure glaucoma. Periorbital pain. Then rubiosis, hemerosis, Figax, that's all ocular ischemic syndrome. If an astigmatism error is less than 0.5 diopters, then you don't need. And not associated with symptoms, spectacles are unnecessary. Skew deviation, characterized by maintained deviation of one eye above the other, frequently fixed for all direction of gaze. So what is wrong about skew deviation? Skew deviation can occur with any lesion of brainstem or cerebellum, but is more unilateral than bilateral. It is present with unilateral internuclear ophthalmoplegia. And the eye on the side of the internuclear ophthalmoplegia will be hypotropic. It will be at a lower level. So, it is generally infrequent in demyelinating lesions. Cerebellum में If it is a cerebellar tumor or a caustic neuroma or a compressive lesion or a platyplasia or a vascular accident, then you will find. But if it is a demyelinating lesion, it is unlikely to lead to skew deviation. With regard to the red eye, blurring of vision is a feature of both keratitis and also uveitis. With regard to optic nerve disease, if it is a retinal disease, it is affecting central vision, macula. They don't have abnormal pupillary reaction. So how does macular lesions affect loss of contrast sensitivity? It is dull unada, dim unada, light unada, bright unada. That is lost if macula of the retina is involved. Maculopathies. Diminished stereoactivity. You don't know the depth perception. Decrease in brightness of object. Even the sun looks dull. But retinal disease, if it is affecting macula, generally have a normal pupillary reaction, is what you need to remember. With regard to the tympanic membrane, shall we call it a day?
Yes.
2 घंटे हो गया. 9:36. Are you happy? So today I have a temptation to skip the class. But because you wonderful guys are coming, I felt hey, कुछ ना कुछ करेंगे क्योंकि paper is like too tough. That's the reason. So don't worry about marks at this point, but try to think, అయ్యో నిన్న తప్పు చేశాను, విజువల్ ఫీల్డ్ డిఫెక్ట్ ఇవాళ చేశాను, రేపు చేయకూడదు. I should not do tomorrow's daily NEETPG mock test. I should not do wrong of what I did today wrong. If you just build that kind of sensitivity, you are my kids. You will definitely make it, right? Thank you very much. Lemon. ఒకసారి సురేష్తో కోఆర్డినేట్ చేయండి. Just come down. Manu?